This is Team 2's podcast on celiac disease. What is celiac disease? Celiac disease is an autoimmune digestive disease that damages the villi of the small intestine and interferes with the absorption of nutrients from food. Every time a person with celiac consumes gluten, the body is attacking itself. Gluten, which is a protein, is found in wheat, barley, and rye. If a person with celiac disease eats a food that contains gluten, their immune system responds by damaging the villi of the small intestine. The villi are finger-like projections that protrude from the lining of the intestinal wall, as seen in the image. They increase the intestinal surface area of the intestinal wall, which allows for the wall to be available for absorption. The gluten damages the villi, and the body is unable to absorb nutrients into the bloodstream. This can lead to malnourishment, and if left untreated, other complications can occur, such as other autoimmune diseases, osteoporosis, thyroid disease, and cancer. Who is at risk? Both men and women of any age or race could be at risk for celiac disease. It has been genetically found that celiac disease is more common in a person that has a family history of the condition. A person with a first or second degree relative that has celiac disease has an increased risk of developing the disease. It was found that it occurs in up to 5 to 10% of people with a family member that has the disease. Another risk factor is having the HLA-DQ2 gene, which is found in about 95% of celiac patients. To determine a person's risk, genetic testing can be done. Symptoms. There are more than 300 symptoms that are associated with celiac disease. Symptoms vary between patients. Some people develop symptoms early in life, while some do not have any symptoms until adulthood. Some people may not have any symptoms at all. Some of the most common symptoms of celiac disease are bloating or gas, diarrhea, fatigue, delayed growth, poor weight gain, headaches, and depression. Through research and studies, there's a lot that we currently know about celiac disease, but there's still a lot that we need to find out. An estimated 1 in 133 Americans, or about 1% of the population, has celiac disease. It is estimated that 83% of Americans who have celiac disease are undiagnosed or misdiagnosed with another condition. There's no cure for celiac disease. A 100% gluten-free diet is the only treatment. In today's world, a gluten-free diet is becoming much easier. There are many products on supermarket shelves which are gluten-free, including the ones shown in the picture. One research study that was recently done in regards to celiac disease is entitled Markers of Celiac Disease and Gluten Sensitivity in Children with Autism. These researchers proposed an idea that there are markers of celiac disease and gluten sensitivity in children with autism. They created a study to test this idea. They gathered information from 140 participants, 37 which were known to have autism, 27 which were siblings of children with autism, and 76 which were considered age-matched healthy controls. They then tested the participants to determine if they had markers for 2 different types of antibodies, IgG and IgA. Both of these antibodies are present in patients with celiac disease. Figure 2 was created by the authors of this study as a way to display the results. As displayed in the legend, the brown lines represent children with autism, the blue lines represent siblings of children with autism, but are not affected by the disease, and the gray lines represent a group of children that are not affected by autism and do not have any siblings affected by it. Both of the antibodies that were tested, IgG and IgA, are shown in the graph as well. There's no difference between the groups with the antibody IgA, but there is a difference with the IgG antibody. The graph shows that children with autism have a higher level of the antibody IgG than the other groups. The researchers concluded that there seems to be a connection with celiac disease or gluten sensitivity in children with autism. There could be a potential mechanism that could clarify the connection of this idea, but much more research must be completed.
Estimating celiac disease sibling risks. Scientists studied celiac disease in order to improve the estimation rates of the disease showing up in siblings of celiac patients. Scientists found that there were a larger number of siblings affected by the disease than those under the median. The scientists concluded that More than half the time, the celiac gene is found in siblings. Potential celiac patients. They were studying how potential celiac patients that have the celiac type HLA positive anti-transglutaminase antibodies but don't have any damage done to their small intestines. They found that potential celiac disease patients have genetic features that slightly differ from celiacs. Using genetic and expression markers, they were able to differentiate the condition. Cause of small intestine damage. In the chart, the scientists were able to underline the values of potential celiac disease patients that were either normal and or penetrated were consistently different from the control groups they had. The IL-21 allele is suppressed in these patients. As celiac patients, the IL-21 allele reverts completely at the levels of control at least once a year to GFD, but it is still higher in celiacs than in potential celiac disease patients. Possible mechanism behind autoimmune disorders. Scientists were aiming to unveil more genetic factors in celiac disease by using genome-wide analysis using the TDT test, transmission disequilibrium test, on infected patients. The scientists had many different findings during this study. This study confirmed many previous GWAS findings, and it established a new genome-wide region containing the DUSP10 gene. They also found the difference between case and controls and their gene patterns in the small intestine. TDT test results. In the figure, it shows the location of all chromosomes 1 through 22 and X. They are plotted on the X-axis. These are the markers from the TDT testing. The scientists expected the region around the celiac disease associated on chromosome 6, showing the strongest association with the most significant p-value. This was confirmed at marker RS424232. This shows the 35 most significant associations found outside of HLA. The most significant finding outside of the HLA region was found on chromosome 1 at the RS12734338 marker.
Researchers conducted a study to understand the gender and racial disparities in biodental biopsy in celiac disease. Previously mentioned, men and women of any race are at risk of having celiac disease. Researchers sought out to find out why some races and gender are more likely to having this disease. 13,091 participants underwent esophagoduodenoscopy, better known as EGD, specifically to measure the rates of duodenal biopsy for symptoms consistent with celiac disease. The conclusions were in the multi-region endoscopy database spanning the years of 2004 to 2009. Rates of duodenal biopsy increased modestly over time. Tests were made to see what are the percentages of getting celiac disease by the race of a person, their gender, where they are male or female, and other factors such as age. In Figure 1, temporal trends in small intestinal biopsy stratified by gender, race, indication such as anemia, weight loss, diarrhea, and iron deficiency, and age. The top left graph is illustrated by gender. Although anyone can get this disease, during the years of 2004 to 2009, women were more prone to having this disease than men, but the numbers were fairly close. The top right graph is illustrated by race. Caucasians, or whites, men and women, are more likely to having celiac disease than African Americans, black, during the course of time. The bottom left graph is illustrated by indication, which can either be anemia, weight loss, diarrhea, and iron deficiency. In decreasing order, diarrhea was the highest, then came iron deficiency, anemia, and lastly weight loss, although anemia and weight loss were very close in the beginning rates. Lastly, the bottom right graph, illustrated by age groups, between the ages of 20 to 49, has the highest amount of people with celiac disease and decreases as the age increases, from the age group of 50 to 69 years old and the age group of any individuals over the age of 70. Given these kind of variables, it gives us information we need to know our chances of getting celiac disease. Given all this information, you ask yourself, well, what are the results? Being that
Being that
celiac disease is common,
but
is underdiagnosed in the United States,
underdiagnosed in the United States,
that
serological screening
at
studies
the same
indicates that
frequency in both
celiac disease
genders.
occurs at the
Women
same
are
frequency in
diagnosed more
both
frequently
genders.
than men in
Women
a
are
2-to-1
diagnosed
ratio.
more frequently than men
Celiac disease
in a
is
2 to
less
1
frequently
ratio.
diagnosed among
Celiac
Black
disease is less
patients or
frequently
African
diagnosed
Americans.
among
The
Black
reason is
patients.
still unknown
The
to this
reason is
day.
still unknown to this day.
Of the
Of the
13,091
13,091 individuals,
58% of them being
58% of them
females
being
and 9%
females
of them
and
being
9% blacks
who met
who
the
met the
inclusion
inclusion
criteria,
criteria, duodenal biopsy was performed in
was performed in 43%,
43% of females,
45%
and
of females,
39% of
and
males.
39% of
Blacks
males.
underwent duodenal
Blacks underwent duodenal
biopsy in
in 28%
of
of
EGD,
EGDs, compared to 44%
for
for whites.
Knowing that celiac disease is
Knowing that
autoimmune
celiac
induced
disease is
by ingestion of gluten
induced by
in
ingestion
genetically
of
susceptible
gluten
people,
in
the
genetically
diagnosis of
susceptible
celiac
people,
disease is
the
determined by
diagnosis
duodenal
of celiac
biopsy.
disease is determined by
In another study,
duodenal biopsy,
researchers sought
which
out
was
to understand the
previously
expression of
In
celiac
another
disease
study,
associated
researchers
genes
sought
in
out to
small bowel
understand the
biopsies of
expression
patients.
of celiac disease
97 people
associated
with all
genes
different
and small
variables were
bowel
included in
biopsies
this
of patients.
result.
97 people with all different variables were included in this research. mRNA expression of peripheral blood monocytes combined with 4 genes allows one to discriminate between celiac disease patients and controls, and between celiac disease patients on a gluten-free diet and disease controls. With the help of the different gene expression, it can help to receive an earlier diagnosis of celiac disease. The first graph is of the SH2B3 gene expression, which was slightly higher in celiac disease patients than in controls, and significantly lower in celiac disease gluten-free diet patients than in controls and celiac disease patients. The second graph is of the TNFSF14 gene expression, which was higher in celiac disease compared to controls and remained higher after 1 year of a gluten-free diet compared to controls and celiac disease patients. The last graph is of the TAGAP gene expression, which was higher in celiac disease patients compared to the controls. This podcast was given to you by Robert Fiato, Melissa Fullard, and Cassandra Clanton. This podcast was given to you by Robert Fiato, Melissa